Hi, this is Ryan Hussey with Granville Township, and I'm here with Rob Petrie from Jefferson Township. This month's MECC Minute is going to be over how to get the most out of image trends. So this is not about how to do a PCR. This is really about how to make the most out of the software and get it to do what you want it to do, and really about kind of speed. So we've been making a lot of changes, and we've been really making a lot of those changes with your ability as a provider to quickly enter data and move around the software without too much hassle. So with that being said, we'll kind of jump right into this and start bouncing through this. So one of the most important things as far as validation rules go, which is what drives your score down here, you really need to download your CAD ticket early. So a lot of the rules are driven off of a date and time, and that's so that when we change things that it doesn't go back and affect old runs. So if you can download your CAD ticket early up here, you would definitely want to do that early on in the run. That really helps get all of your rules read so that things aren't turning red later in the run. The other thing that really helps get that going, and the reason it's at the street sheet or on the street sheet, is the disposition. So you want to select your disposition early so that all of your red fields turn red before you start entering data, as opposed to getting done with your run, entering your disposition, and then going back and having to add things that may have become required while you were entering fields. Does that sound all good?
Sounds perfect.
Awesome. Okay, so I think everybody's pretty familiar here with the repeat patient field, but there's a couple things with that I think that are important to highlight. So as we start to enter information here, we get the banner up top. It starts to tell us that we have somebody that matches our patient that we're entering, the name. I think a lot of people typically click this download button, but one of the cool things is the preview button, the eyeball on the left. You have the opportunity to see what was put in on the run before you. So you can verify these. You can deselect them if it's something that they're not taking anymore as far as medications go. You can toggle through to their allergies and their history as well, and then decide to download. One of the other benefits of this is that you can open it up and you see that the person before you did not put any good data in there. You might choose not to download that repeat patient. So on this one, we say, yep, those are all things that are going on with this patient, and we want to download that. So it brings all that information into our street sheet. So the repeat patient database is pretty strong as far as it starts to figure out based on just a couple fields that you put in. You don't actually have to go hit this find repeat patient button, although you can if you're just trying to find, search somebody off a date of birth or something like that. So typically we're working down through the street sheet. One of the only things we're going to have to put in here, we'll just put in chest pain. Again, this is nothing new for anyone. So we worked down through that. One of the other things that we did as far as a change that we made that you've probably all seen by now is we added some things to the chief complaint. So of these changes, a lot of this was meant for speed, so we actually took away a lot of rules. But in the chief complaint section, we actually added a little bit, and it's really to help make your documentation more thorough, but also to kind of help you with your radio report and your report to the hospitals, kind of make sure that you're hitting all the points that the hospitals are going to want you to hit. So if you have a stroke, you now have a possible stroke button down here. If you hit no, nothing happens. If you hit yes, you get another panel over here on the left-hand side that pops up, and it is required. If you hit unknown, the panel stays popped up, but it is no longer required. So we're going to say yes, this is a stroke. This date and time last known well, that's nothing new. But all these other questions about previous stroke or head trauma, blood thinners, head trauma at onset, those are all those questions that your stroke centers are going to be asking you, or they want to hear as part of your radio report. So we felt like those would help us have better documentation and better radio reports. So we added those in there as kind of a tool for you so that you can hit all those points while you're documenting. Anything more on that?
No, I think that's perfect.
Awesome. So The next set of changes here, I'm downloading a case from the cloud. And this is not a real case. This is something we did here for training purposes. When you download a case, I think a lot of people are used to just opening this vitals tab, and they go in here and they see all these things that are required, and they just start going in and fixing them. The best way to start to fix all those is to actually use the power tools. And the way to access the power tools on things you've already downloaded is through this timeline button. So on the left-hand side, or sorry, the right-hand side here. So when I get into this timeline, I can click on the procedure that I want to enter. Especially if I'm working in a tablet mode, this is much easier for me to enter data. So it puts a lot more things into tiles as opposed to being drop-down lists or in text boxes. So and now you can see here that I've satisfied all of the validation rules that need to be satisfied for that procedure. And so I can jump back into my timeline, and again I see that it's good to go here. One of the things that you've probably already recognized is that this medical device that imports anytime we have a 12 lead, anytime I push the print button, anytime I import a 4 lead, that was something that we were having to go back and touch before. So I think, what was it, ECG, cardiac rhythm was required.
Cardiac rhythm was required.
Yeah, so we turned that off. That does not upload to the state, and there was no requirement that the state wanted us to fill that out. So we turned that off to make it easier to document. So what we didn't want is people to go in there and be deleting those because that is how you get waveform monitor strips into your report. With that being said, anytime you push the print button, you're capturing and putting that into your report. So let's see. Here, I wanted to capture capnography on this patient on the waveform, and so to capture that waveform, I just hit print. And here shows me my print 1, and this actually attaches and prints with my report. So I didn't have to do anything else with this. I just pushed print on the monitor and it uploaded, and now I don't have to go back and touch any of this anymore. So again, that was a change that we made recently. So hopefully that's a good one that makes a big difference for you guys on the streets.
Yeah, I think that'll be very helpful.
Awesome. So the next big change we made is we made some changes to our vital signs. So again, try to use the power tool because a lot of this is a lot easier on an iPad or a Surface Pro to enter using the tiles. So this patient was sitting, alert. We added some extra fields. So we added an airway field so we can say this patient's airway is patent. That's not a required field necessarily, but some of these other ones are. So respiratory rate was 15 and normal, heart rate was regular, pulse quality normal. We have some qualifiers here on our pulse oximetry, and then also some extra fields on our blood pressure. You may have noticed a while ago that some of our fields, when we would click not applicable, would remain red. I have tried to fix most of those. If you find some that are still not working, please let me know or let your EMS coordinator know so that they can let me know. So any of these that are not applicable to the run, you should be able to just click not applicable. That should satisfy the rule, and we'll get it grayed out basically. So the first set of vital signs has a lot of rules, but one of the things we did is we made it so that all of the following sets of vital signs are trending vital signs. So as soon as you fill out one complete set of vital signs, you do not have to go back and touch the rest of your set. So if you're having a long transport, maybe you're transporting to across Columbus to a further destination, and you have 5, 6, 7 sets of vital signs, that could take a lot of time sometimes. But really what we wanted out of those was trending of the things that our monitors really already picking up. So you can see here we have 4 sets of vital signs. I only had to go in and click that the pulse was regular and that the breathing was normal in one set and fill out a complete set, and that the rest of these, all of the rules grayed out and are no longer required. So with that being said, it doesn't always have to be your first set. So maybe your first set, all you got was pulse and respirations, and then in the following set you got a blood pressure. Well, as long as you have one blood pressure and one pulse and one respiration and one of all the qualifiers on all those things, that's all it requires. So if you got a blood glucose on your third set, if you enter blood glucose down there, that all the rest of these will gray out as far as the blood glucose is required. Does that make sense, Rob?
Yeah, I think that it'll definitely speed up the process, because the hard part is, I think there's people deleting out sets of vitals again when there's so many, instead of the trending values that'll be beneficial, especially down the road if it's a patient that may not be as stable.
Awesome. Yep, we're hoping that this is makes it easier for everyone. The only thing you need to be careful of is that obviously if your monitor gives you a wonky value every once in a while, you want to make sure that you don't document those. So you just want to look at least through your timeline here and make sure that the things that that your monitor is capturing are accurate. So moving on here, one of these other things that we uploaded. So these medication givens, these were based on the event buttons on my monitor. So I pushed event and then oxygen. Again, I jump in here to use a power tool, and I only have to fill out a couple things, and then it's done. Yep, I say 4 liters a minute. So that was, again, that comes in off of my event button on my life pack, and I assume that the Zoll works in a similar fashion.
Yep.
The generic events here, what we did, if you just push the event button twice, it enters a generic event. What we wanted to do was create a way to capture that timestamp in the software. So it imports a medication generic and a procedure generic. So what you need to do is, let's say that this generic event that maybe we started bagging the patient and I didn't have time to turn and select bagging. So I say we were bagging without an airway. Okay, so now I've got that procedure in here, and it took the place of generic event. Generic event, you cannot complete a report with a generic event, but what we wanted to do was to still capture that timestamp. So what you will need to do now is go in and say, well, this wasn't a medication, it was a procedure. I'm going to delete that one, and it clears that one out of there. So I'm starting to get rid of a lot of these red fields. Aspirin, same thing as the oxygen. I click that when I on my event button. A lot of this other stuff is already defaulted for you to speed up documenting. 12 leads, same thing. While we have this open, one of the other things that's pretty cool that if you have a patient that is a repeat patient, you can look at the last couple times that you ran on them and say, okay, was their blood pressure, what was their blood pressure? So on the 18th, we ran on this person, their blood pressure was maybe a little high. We took them for blood pressure problems that day. We ran on them again here, and it looks like it's coming down a little bit, and oh, this is much more normal. So you have the option here to look at past data all from within your report, which can be really, really powerful. So dispatch reason, okay, we went chest pain twice, and now we're here for a sick person. Or primary impression might be helpful sometimes. So a lot of your vital signs and then your dispatch reason and primary impression are all in there. So that's all under patient encounter, again, under timeline. So we're just toggling back and forth between these two tabs up here. Kind of continuing on with power tools, a couple of the most important power tools we try to put towards the top. So if I have an IV, I need to be able to document that quickly. I pick between IV and IO. We deleted the IO power tool and just made all one and the same. This was an 18 gauge. Successful. And again, the rest of this all is defaulted. This add medication button down at the bottom, this gives me the ability to say, yes, I did a 10 ml flush. And again, the rest of it is defaulted. So with basically 3 button clicks there, perfect. So I got my IV documented rapidly there with my power tools. So the blues, all power tools, yellows are situation tools. The other power tools that are up here towards the top, blood glucose, capnography, and 12 lead transmit. So the capnography one, everything is already defaulted for you. All you had to do is open the tool. If there's anything you need to change, you can change it. Click OK. It timestamps it and puts it in your report. So basically like hitting a button on your monitor. Transmit 12 leads, one that is a procedure that should be in there. Unfortunately, we can't get that to download from Physio or Zoll, I believe. So we put that in there as a power tool so that you can enter 12 lead transmit time. If you want to put something in the comments that says, yes, we transmitted that to Mount Carmel East, hit OK and keep moving. A couple of these are built in. The built-in assessment tool is fantastic. So if you're trying to do assessments, definitely don't do this from the left-hand panel tab. Mental status, oriented, person, place, time, and event. Hit OK, and that tags it in there as an assessment. When you go in here to do an assessment this way, it's very, very cumbersome. So I would recommend definitely using this assessment power tool tab anytime you want to do an assessment. Situation tools, they're meant more for timestamp, and I'll come back and finish later. So I do IV right now, and I do 15 liters a minute of oxygen. I hit OK. I go back to my timeline, and those two now need me to go back and open them up in the power tool and enter the rest of the data. So I'd really use a situation tool more so when I'm don't really have the time to enter the rest of that data right now. So the rapid entry, and again, we're going to continue to build this out with things that we get feedback on, of things that people want to see here, of different tiles. The other situation tool, we access them up here. So chest pain, it has all your different chest pain medications. So a lot of times when you're in the middle of a chest pain run, very much like hitting a button on the monitor, you want to just hit the button, timestamp it, and I'll come back and get the rest of that data later. So that's what the situation tools are. So situation tools basically timestamp it and let you come back and touch the power tool once you're all done. Anything else to add on the situation tools and the power tools?
Well, I think it makes that flow of your run a little smoother if you can timestamp without having to worry about filling all the information out at once.
Absolutely, absolutely. Real quick, I'm going to jump back into vital signs because I missed something here earlier. When you go to do a stroke exam, you'll notice that where am I here? If I click my stroke exam as being positive, non-conclusive, or negative, I get a couple more fields that open up here. We defaulted this to a LAM score. I enter what I need to here, and then it actually auto-calculates my score now. So we hid those fields so that it doesn't clutter your screen when you're not using a stroke exam. But when you are doing your stroke exam now, you can get a LAM score. One of the other things we did in Vital Signs, and you actually access this through the Vitals tab on the left, and then you would add kind of the old way, is an APGAR score. So again, at 4 in the morning, this might not be right on the top of your brain. So you go through and enter these fields, and it gives you your APGAR score accordingly. So helps you kind of helps you document, but really helps you in your assessment and kind of your interface with the hospital and being able to articulate those scores appropriately. When we a couple other things that we did here. When you enter a weight-based medication or have a patient under the age of, what was it, 13? Yeah. Under the age of 13, it now requires a weight. So I enter fentanyl. I'm not going to fill the rest of that out. I just want fentanyl to be a weight is now required. So this was never read before, but that is one of those things that it will be required now because I put a weight-based medication. And that's really just to protect us so that we can explain we gave this amount of medication because this is what we estimated the weight to be. So it's just kind of better documentation in that standpoint, so there's no asking questions after the fact and well, we think that we estimated the weight to be this. So it's just, that's one of those things that probably should have been a rule from the get-go. Also along those lines, I enter an intubation. You'll notice that airway confirmations is now required. So this is, again, a tool that most of the time we're not going to touch, but is really important as far as documenting these things when we do an intubation or an iGel procedure. This field is now required, and we can do this as many times as we want. Because this is a grid, we can add as many confirmations as we want in here. So I go in, I say, yes, this was an ET tube. My confirmation method was auscultation. 3 more tiles pop up, yes, yes, and no. Maybe I use chest rise. 2 more tiles pop up, yes and yes for chest rise. Some of these don't have additional fields that pop up. So if I just say, yes, I used waveform capnography, then that would be a situation where you would definitely want to hit the print button around the same time as you were documenting that you confirmed this airway. So tube depth, we moved out of procedure and into here. It's just the appropriate place that we should be documenting that, and it also allows us now to say where we really measured that at, and then who is confirming this airway. So again, I can add as many confirmations as I want in here. So when if you're moving to the truck, maybe you would do another confirmation once you get in the truck, and then maybe once at the hospital or something like that. So you might have 2 or 3 of those. There's no requirement to have more than one. The requirement is only to satisfy the rule to have one, but that's where you could do it if you wanted to have more. Again, if you're wanting to see the strips in your from your import, this is where you could go to see what your 12 lead looks like, and make sure that everything came in appropriately. So those are the medical devices that we turn those rules off in. One of the other rules that we changed is we are no longer requiring a crew signature. So before, if you had entered a medication, we would require a crew signature. The pharmacy board really only requires that each person giving a medication signs a report. So for most of you that are running 2-man medics, that is the primary care provider. So as long as you sign now that you're the primary provider, and you have your patient signature, your signatures are not going to have anything else required. Controlled substances, if you gave fentanyl, which we did have clicked in here that we gave fentanyl, so your controlled substances is still going to require 2 people anytime that you give or waste a narcotic. But we turned off that crew signature. The pharmacy board didn't change their stance. What we realized, it was just creating a lot of extra work on it for runs that where most of the time it was just the primary provider providing that signature. So to still be fully compliant, if you have someone that is signing or that gave a medication and you're documenting that somebody else on your crew gave a medication on a run, you really should have them sign the report as well as a crew member. So you can still do that. It's not going to throw up any red flags. You go in here, say who it was, and have them sign just like we used to. So we're just trying to, again, make that easier for the guys on the street. Looking at worksheets over here on the side, this is something that we build in. These are forms basically straight out of the protocol so that you can better document whatever situation you're put into. So if you have a treat no transport, this is straight out of the protocol. You could go through here and document this, and this just attaches it to the back of the report to kind of a cover your butt situation. Again, a lot of these are similar in that regard. So you have capacity to refuse, diabetic discharge, termination or resuscitation. This is the actual refusal checklist that's in the protocol. You probably have all noticed by this point that we've turned off the COVID form as far as PPE goes. This COVID form down here is the non-transport guidelines that we never enacted. And then this LAMS worksheet we actually are taking away because the LAMS score is now being calculated as part of a vital sign. So this should be gone by the time this MECC minute makes it out. So if you have any suggestions for other worksheets over here that you would like to see that would be helpful to document, please send those to your medical director so we can get those in there. Sorry, not medical director, EMS coordinator. Yeah, EMS coordinator. Yeah. Awesome. Okay, so wrapping up here, just a few other of the functions of this program that I think are pretty cool. Attachments. So if you want to attach a photo, you just take a photo with your device. Depends on the type of device and where it puts it, but you go to browse so you can find it. Maybe it's a face sheet, maybe it's a picture of an accident, maybe picture of the damage of a vehicle, med list, whatever it is, you can attach it here. So it says it's pending. You click OK, and it goes through a little save sheet there so that it can attach that to the back of your report, and that should print with your report if you're using the same print as the rest of the system users. So along the same lines with the print stuff, we changed the print form to exclude a lot of the drop-down fields. So one of the things that I never liked is that I would have to be forced into picking out of a pick list things that I didn't necessarily feel like were 100% accurate. So what we did is eliminated most of those. So you don't see primary symptom or primary impression on here, just chief complaint type, which this is freeform text. So we did that with a lot of the fields on here. We eliminated those. So if you ever have a print form that's requested by a attorney, they're getting what you wrote, not what you had to pick out of a pick list. So again, it still goes to the state. It still goes into the PCR. You still have to pick all those fields. They are required by the state. But what we wanted to do was not necessarily misrepresent what happened on the run as far as if you're called to court or something like that. So the print form is cleaned up a little bit in that regard. The last thing I want to highlight here is that we are able to manipulate the data set a little bit. So in primary impression, I believe, we had some feedback at the last meeting we had that pain general was missing out of here, that most of the pain complaints were too specific. We also added abnormal behavior and illness unspecified. Those were all data elements on the state side that were acceptable, that are just turned off on the backside. So there were, and some of them we had to relabel kind of what they look like on the front side, but on the backside, these are all fairly similar in the way they're worded. So if you guys have anything that you like to see in a dropdown that would be in the EMS data set from the state, we are able to manipulate those lists. So if you have suggestions, bring those to your EMS coordinator. We can also change the sorting order of those lists. So if you wanted to see illness unspecified before acute abdomen and overdose and flank pain, we could make it number 1. So we can reorder this, we can alphabetize it or whatever. So if you have any suggestions like that, or after watching this, do you have any suggestions over any of the power tools or situation tools, definitely please get those to your EMS coordinator. With all that being said, I'm going to turn this over to Rob, and he's going to go over the ID scanner that is a function now of the iPad that I believe Jefferson's using. So,
using the driver's license 2D scanner, this is only going to be available if you use the iPad. If you're using a Surface Pro or a Toughbook or another computer, you will have to actually use the driver's license barcode scanner or strip scanner, and that does require having a mag strip reader that you plug into the USB. We are not going to cover that as that none of the departments that we're working with currently have chose to use that. If you do use it that way, please look into that. It'll be the third button down. Today we're going to do the driver's license 2D scanner. When you pull it up, you're going to see it's going to bring up this Open Elite Utilities. If you don't have Elite Utilities installed on your device, it's not going to work. So let me jump back out of this and go into your App Store. When you go to the App Store, you're going to be looking for ImageTrend Elite Utilities. And as you can see on mine, it shows that it's to open, so it's already been installed. If it has not been installed, you have to make sure that you get with whoever's managing your iPad if you need the password to install an app. Going back into our report, we click Open. And you're going to notice that it's going to bring up the camera. At that point in time, you can see that your driver's license, as you normally would, you flip it over. You're going to have this barcode, digital barcode on the backside. Just bring it down in. You want to try to give as much contrast, so a nice light area, and then also making sure that you stay pretty still with the image. After about a second to 2 seconds, you will get all of your information pulling up. This is all of the information that's going to transfer over into your report. A lot of people get held up on this, though. When you hit OK, nothing seems to happen. And actually, there's a glitch in this system. You need to, after you hit OK, go ahead and hit cancel. It'll bring up discard driver's license information, say OK. and then you'll notice that all of your information has actually been imported. This will be helpful with body weight and also with all your name and address, date of birth information that will all populate. You will not get a social security number, as that has not been included on driver's license data. After this has been imported, you will now be able to, when this report is saved, repeat patients then will, when you go to search for them, they will have all the correct data, and those repeat patients will be able to be found easier. Ryan, do you have any other information?
No, I think this is just a great tool for, especially when you have names that are difficult to spell. We run into it a lot where maybe names get misspelled on a previous report, and then you're going back and looking for that repeat patient, and you can't get any of that data that maybe was really relevant, especially now that we can kind of see the trending from previous runs. I think using those repeat patient functions are really, really important to good care. So again, none of this was intended to tell you how to do a PCR. It's just kind of trying to highlight some of the cool functions of image trend, also to kind of show you where we can make changes if you think that it could be better. So we're always open to criticisms, and if anybody's got anything that they want to bring to the table, we welcome that information, and we'll try to make it as great as we can.
Very good. Well, thank you, everyone. Hopefully you've enjoyed this and it's been informative.